Hey guys, Tony Maritato here. Welcome to the Total Knee Replacement Support Group YouTube channel. So it's late in the evening, and in this video, I want to share some ideas. You know, I don't ever claim to have the answer, but what I try to do is ask better questions. So here we go. I've got an individual patient. She works incredibly hard. She had a total knee replacement. Sometime, shoot, I don't remember. I didn't see her after the initial knee replacement, but I'm going to say sometime in July. It's October 3rd now. No, it's November 3rd. Goodness. November 3rd now. She had the initial knee replacement. She was frustrated by not getting the range of motion back that she wanted. She worked hard, and by the time that we connected, I believe she had already been over 10 or 12 weeks post-op and was just struggling to get anything above 90 degrees. Now, when I meet a new individual, you know, it's always a little bit challenging for me since I don't know the history, I don't know the personality, I don't know what makes somebody tick. One person says, I'm working hard as heck, and, you know, I don't know what that means. But this particular individual, we had an opportunity to work through several physical therapy sessions over the course of about a month. And every time she came to therapy, she just worked as hard as she could. She was doing, just to put it in perspective, she was doing, you know, initially 10 up to 30 minutes of continuous walking on an elliptical trainer. She was doing all of her stretches. She was doing her squats. She was doing anything that I would ask her to do. Regardless of whether it hurt or was challenging, she was always willing to do it. And she was doing more outside of therapy. And so I can usually tell when somebody is really just pushing themselves. Sometimes I tell them, look, you're pushing too hard. Actually, I probably say that more often. But I can tell the person's personality, right? Okay, so you get the picture. She was working like crazy, and she was not getting the improvement that she was looking for. Now, we had a conversation. Her surgeon had given her the month to improve her range of motion, or the surgeon wanted to do a manipulation under anesthesia. She asked me what I thought. I said, I don't have an opinion. If you want to do it, do it. If you don't want to do it, it's your body, it's your knee. I think the range will come with time. It might not come on, you know, a time frame you would use a watch to measure. It's probably going to be more like a calendar. It's going to be months and maybe years before you get the range of motion you want. I don't think a manipulation is a bad idea in any way. I think it could definitely speed up the process, but she was absolutely reluctant until the time came where she knew that she put everything she possibly could into getting the range of motion and just was not getting it. Now, what's kind of interesting about this particular case, when we would bend her knee, when she would bend her knee, she would get like a catching, a pinching in the back of the knee. It felt like, and was described to me like, more of a mechanical block than tightness in the joint. You know, there's certain characteristic sensations of a tight joint. To give you an example, so if I go to flex my wrist, right, there's thick connective tissue that surrounds my wrist. When I flex my wrist, it's a little uncomfortable. I feel the stretch where I would expect to feel the stretch. I do not feel pinching in this area. But in her case, when she was flexing her knee, she would feel a little stretch where you would expect, but she would also feel pinching, described as biting, in the back of the knee. Okay, we tried some different strategies. We could kind of relieve it, but never really quite enough. And so she decided to have the mobilization. Now, the mobilization took place on a Friday. I was just looking at my calendar, a little over a week ago. During the mobilization under anesthesia, manipulation under anesthesia, she was told that she had reached 135 degrees of flexion. In my clinic, she was unable to get past about 93 degrees of flexion. So huge range of motion change. Now, I hate the fact that I wasn't there. I hate the fact that I couldn't see it. I couldn't feel it. I couldn't determine for myself whether it was tissue restriction or mechanical or what was going on. So again, I'm kind of, as the therapist, I'm flying blind because I don't know what happened during the manipulation. But I can tell you that the day after, she started physical therapy with the surgeon's physical therapist, and where she had gotten to a reported 135 while under anesthesia, the next morning she was back to 100. Now 100 was more than where she was prior to the manipulation, but nowhere near where she was during the manipulation. And so you have to use a little bit of logic, and you have to say to yourself, well, clearly she didn't grow scar tissue overnight. Now, it's normal to lose range after the manipulation. Things are swollen, things are inflamed. Truthfully, I saw her 2 days after the manipulation. Her knee looked beautiful. I didn't see any sign of excessive swelling, any redness. I mean, the knee looked amazing. But she was still stuck at about 100, 101 degrees of flexion. She worked like crazy. She did all of the exercises. She did the bike. She did the elliptical. She was able to do some kneeling. She was able to do multiple positions and methods to improve the flexion. We did posterior glides. We did everything we were supposed to do. And it was just like she was just hitting a wall. She would get the tightness on the front outside of the knee like you would expect, but she continued to get the pinching in the back of the knee. And of course, you know, I feel for her. I empathize with her. It's frustrating, because she, as the patient, you as the patient, know that you are doing everything in your power to do it. There is just nothing more that you can throw at it. And I think, as the therapist, you as the patient tend to start feeling that other people are thinking you're not doing enough. But I know you are. I see it. I can hear it in your voice. I can see it in the stuff that you do in the clinic. So, you know, the whole point here is you are the only one inside your body. You are the only one who knows what you're doing, how hard you're pushing, how much you're trying. You know what the restrictions are that you're feeling. And nobody outside you can really connect with your frustration. My hope for you is that you have a therapist, a rehab team, that can at least empathize with you, can at least support you during this challenging time, because they certainly don't have a solution. I certainly don't have a solution. We know that there are people who have a manipulation and don't get improvement. We know there are people who have the manipulation and get great improvement. I've seen both. I've been doing this almost 20 years. I've seen multiple cases and multiple situations. All of that being said, my advice to you tonight is continue to analyze the situation. Continue to ask better questions. Try to dig deep. Try to figure out what is going on. Is there a mechanical issue? Maybe it doesn't show up on x-ray, but maybe when you're actively moving the knee. Remember, an x-ray is just a still picture in time. But maybe when you're actively flexing, the hamstring is pulling the tibia back. Maybe there is some soft tissue that doesn't show up on x-ray that's causing you issue. Certainly, you know, there's a pain response there. So if you're under anesthesia and the knee can bend, and then you're awake and alert and the knee cannot bend, there are reflexive protective mechanisms in place that no matter how much you try, they're going to limit that motion. But talk to your surgeon, because there are other things that could be done. You know, I don't know. I'm not the surgeon. I'm the therapist. I'm sharing this video tonight because I think there are lots of you out there who are frustrated. You're not getting the range of motion that you want. You're seeing other people that are you know, celebrating just incredible improvements, and you're sitting there wondering, why not me? I do everything right. I follow all the rules. Why am I not getting the range of motion? And the reality is, I don't think we have an answer, but the best thing we can do as physical therapists, as surgeons, as healthcare providers, is do our best to ask better questions, try to dig a little deeper, be willing to experiment, but most importantly, be willing to support whatever your decision is. You know, we only have so many tools at our disposal. You're the one that makes the final decision on what you want to do next. So guys, it's late. I'm gonna head up to sleep. I appreciate if you've been on the video this long. I appreciate your time. I appreciate your support. You guys have been doing a tremendous job helping me grow this channel. And the more reach we get, the more people we can help, the more questions I can answer. And I always thank you for every subscriber that clicks that subscription button. I thank you for every thumbs up that you're willing to click, because that does really go a long way in helping me grow the channel. I hope you have an amazing night, and please don't hesitate to reach out, post your questions in the comments under the YouTube video, and I'll catch you on the next release.